talking about multiple sclerosis. So basically what happens is your body attacks myelin sheaths in your CNS, which is your central nervous system. And this is important because if you think about the nerve and the sections of myelin sheath that help the signals travel faster without losing energy and dying, since they're moving slow here and then they can kind of skip a beat. Sometimes the motor unit that the brain is trying to talk to, let's say it's trying to talk to your foot, it, without the myelin sheath, will just be slow. Let's say you have parts of your myelin sheath here, so it's a little bit faster and then slow, and then this one's also broken up, slow. So it might never even get there. By the time it's here, just die off. So that's why MS is so difficult. How do they find MS? They can find it through lesions. If you have 1 or 2 lesions, you can be diagnosed with MS, and you can see it in an MRI. And it's lesions in the brain or in your spinal cord, because remember, it's only in the CNS, not the PNS. So now let's talk about some different types. So there are different types and grades of MS. So one of them is called relapsing remitting MS. I'm just going to put RRMS. And then there's also primary progressive MS, PPMS. And then there's a mix of those, so I'm just going to say mix MS to kind of keep it RR, PPMM. And then there's also benign MS. That one's that BMS. The difference here, if I could draw a chart, let's say this represents time, and this represents your ability to function. Let's say with remitting MS, your function level is high, so you find out you have MS, you go through a little dip here, and then it gets better and you normalize. But then you remit, have some more difficulties, and then you normalize again, because it gets a little bit better and then it gets stable. But as you can see, this still slowly is going down. So eventually they do lose function. With primary progressive, this, and by the way, let's just add that this is 85% of patients with MS. 10 to 20% of cases are primary progressive, which means there's no remission, it's just a continuous loss over time. So with this, it's basically, you're fine and you find out you have MS, you progressively decline. So this is 10 to 20% of patients. And then we've got a mix, and 50% of cases can have relapsing remitting, and then it changes to primarily progressive. So that would look like this, but then let's say at this point, they just go downhill out of the blue. So that's 50% of cases. And then with benign, you fluctuate and you have dips in function and then they go back, but they return to full function. So this, let's say this is their full function, they have a dip, then they're back to full function, dip, full function, dip, full function, dip. So with that, that's probably the best case scenario because there is no overall digression over time. Once you have remission, you typically can be back at the same place you were previously. MS victims are between 30 and 50 years old. And it is more likely for women to get it. It's 3 to 1. This is woman to men. That's MS.